Okay, hello everyone. Welcome back. We are going to dive into chapters 8 and 9 today. These are a little bit, they're not necessarily a lengthier chapter, but they do both have quite a bit of information. So these will be in two separate videos and two separate ed puzzles for you guys to do today. Okay, so with that, we're going to start with chapter 8, which is the hormones. I thought this was a pretty funny slide. All right, so we're going to start off with the endocrine system and a little bit of a review. So as we know, the endocrine system works with the nervous system to relay messages and to maintain homeostasis in the body. It communicates by sending chemical messengers, or hormones, to target cells all over the body. And the hormonal actions on the body are really categorized into four main groups. Okay, those that regulate the internal chemical balance and volume of our bodies. They respond to environmental changes. They respond to growth and development and reproduction. All right, hormones are classified as either steroid or non-steroid. The steroid hormones are derived from cholesterol, and they can be classified as glucocorticoids, which are cortisol, mineralocorticoids, which is aldosterone, estrogens, progestogens, and androgens, which are the male sex hormones, primarily testosterone. Okay, then we have the non-steroids. These are synthesized from amino acids. The simplest form of these are amines, which are synthesized from a single amino acid, and they include epinephrine, norepinephrine, thyroxine, and triiodothyronine. Say that 3 times fast. Okay, hormones are made of short amino acid chains. Those are called the peptide hormones, and they include the antidiuretic hormone, which is ADH, and oxytocin. The protein hormones are larger folded chains of amino acids, and these include the growth hormone, the parathyroid hormone, insulin, and glucagon. We'll go over some of these endocrine glands here. First, we're going to go over the pituitary gland. As we know, this is known as the master gland. Okay, it regulates function of the renal system and of the thyroid gland. And a vital role is also played in reproduction and growth with the pituitary. Okay, it's connected to the hypothalamus by the infundibulum and has 2 lobes. The adenohypophysis is the anterior lobe, and the neurohypophysis is the posterior lobe. Hormones that are secreted by the adenohypophysis are the human growth hormone, that is our HGH, our TSH, which is our thyroid stimulating hormone, adrenocorticotropic hormones, prolactin, dopamine, and gonadotropic hormones. The hypothalamus synthesizes oxytocin and vasopressin and transports that to the neurohypophysis where they're released to the body. Okay, the pituitary hormone is important to surgery is oxytocin. Okay, the common trade name for oxytocin is Pitocin, which I'm sure we've all heard at some point. So Pitocin stimulates uterine contractions for childbirth. It can be administered IV to induce labor if we're not naturally making our own. And it's given post C-section to stimulate uterine contractions to slow down that postpartum bleeding of the uterus. If the contractions, when it's given IV, is not firm enough after a C-section, then it can be injected directly into the uterine muscle. So our nurse would go and get us some, we'll draw it up, label it, and hand it to the surgeon to be directly injected into the uterus. Okay, next we're going to cover a little bit about the thyroid gland. This is the largest of the endocrine glands. It's got 2 lobes joined by an isthmus, and it sets the rate of body metabolism. So in children with hypothyroidism, we're going to see some stunted growth and developmental delays. A lack of thyroid hormones can also slow our metabolism. And in adults with hypothyroidism, meaning that they're not producing enough of the TSH, we're going to see sleepiness, tiring, a lack of mental alertness, reduced endurance, and bradycardia, which is a slowed heart rate. Okay, on the flip side of that, in a person with hyperthyroidism, we'll see restlessness, nervousness, sweating, and tachycardia, which is a faster heart rate. And the most common cause of hyperthyroidism is Graves' disease. This is an autoimmune disorder where the body attacks the thyroid gland and causes an overproduction of thyroxine. It's most common in women under 40. A lot of indicators of Graves' disease are anxiousness, sweating. A real good tell-all is the puffy kind of exophthalmia or buggy eyes. That is a good indicator of Graves' disease as well. Excuse me. All right, so the thyroid gland secretes 3 important hormones. That's T3, T4, and calcitonin. T3 and T4 are regulated by the thyroid stimulating hormone, and they're vital for normal growth and development. They regulate the metabolism of our carbohydrates, lipids, and proteins. Okay, calcitonin helps control the calcium and phosphate concentrations in our blood. The thyroid hormones are administered to treat hypothyroidism caused by the disease or surgical removal of the thyroid. Hypothyroidism is usually treated in the medical setting rather than the surgical setting, so we really aren't going to be administering any kind of medications or hormone replacement in the surgical setting for thyroid disease. And then we have the parathyroid glands. These are actually small, kind of yellowish brown ovals that are embedded in the thyroid. There's usually anywhere from 2 to 12. Most of the population averages about 4 parathyroids in their thyroid. Okay, they produce the parathyroid hormone, which monitors circulating concentration of calcium ions in the blood. There are 4 major functions of the parathyroid. That is to stimulate osteoclasts. And remember, as a review, these are the large cells that dissolve bone and continually break down old bone. They inhibit osteoblasts, and these are the cells that form new bone. They enhance reabsorption of calcium at the kidneys, and they're going to stimulate the formation and secretion of calcitrol at the kidneys. Okay, hypoparathyroidism is a low calcium concentration. It can cause tetany, which is a form of a prolonged muscle spasm almost. Usually affects the face and upper limbs, neck, where those muscles go into almost a prolonged spasm. They get very tight. Okay, Forteo is a synthetic form of the parathyroid gland that can be administered to treat hypoparathyroidism. But again, this is done in the medical setting and not in the surgical setting. Okay, hyperparathyroidism, on the other hand, causes the bones to grow thin and brittle, skeletal muscles are weakened, and the central nervous system can be depressed. So usually what we're going to do here is surgical removal of the parathyroid if that's indicated. All right, moving on to the adrenal glands. These are pyramid-shaped glands that sit on top of the kidneys. They're highly vascular, and they consist of a central medulla and an outer cortex. The central medulla is going to secrete epinephrine, norepinephrine, and dopamine. Collectively together, these are catecholamines. They mimic the effects of the sympathetic portion of the autonomic nervous system. And if we remember, the sympathetic portion of that is our fight or flight syndrome. All right, so epinephrine is used frequently in surgery. It's often used in combination with locals like lidocaine and bupivacaine to prolong anesthesia. When injected in diluted amounts, it causes vasoconstriction and reduces the absorption rate of the anesthetic. That's what's going to make that local effect last longer. That's what makes that numbing sensation last longer. Okay, concentrated epi can be used topically for hemostasis in limited areas. In the middle ear, for instance, I know we have talked about before, gel foam may be dipped in epi and applied topically to reduce capillary bleeding. These are only going to be in small areas. Okay, if a concentrated epi is injected, it can cause tachycardia and hypertension, and these can be fatal. Okay. It is contraindicated for injection in areas with limited blood supply. Obviously, if it's acting as a vasoconstrictor and these areas already have a limited blood supply, the last thing we want to do is restrict any blood supply to get to that area further. The areas that we want to take note of that we don't want to use epi in are our fingertips, toes, the tip of the nose. Those are contraindicated for using epi. Okay, and a good side note is another word for epinephrine is adrenaline. That is what it is also known as. We'll talk a little bit here about the steroids now. The adrenal cortex hormones are glucocorticoids and mineralocorticoids. Collectively together, they're called steroids. So the mineralocorticoid that is of importance to us is aldosterone. It regulates the levels of sodium and potassium in the blood. The glucocorticoids, significant to the CST, are used as anti-inflammatory agents in postoperative situations. As an example, I have here in parentheses Kenalog and dexamethasone. Oftentimes we will mix those two together and inject them intra-articularly. So after a shoulder scope or a knee scope, we may inject those steroids in as an anti-inflammatory when we're done with the surgery. Okay, they're used medically to prevent rejection of donated organs. There is a good insight about that on page 107 that is pretty interesting. And to reduce inflammation in arthritis patients. However, when we are administering these steroids to arthritis patients, they are known as palliative treatment because they are relieving the symptoms, but they're not curing the disease. It's really just putting a Band-Aid on it. All right, the glucocorticoids might be administered orally, topically, IM, IV. They can be inhaled, or as we stated a minute ago, they can be intra-articular. So some natural steroids that we produce include cortisone, aldosterone, and deoxycorticosterone. But there are a lot of synthetic glucocorticoids that have been produced, and this list here is one that we will often use in surgery. So I'm going to leave this up for just a few seconds so that you guys can write those down. But they are Medrol, Depomedrol, Solumedrol, Kenalog 40, and Decadron. As you can see here too, if you remember from some previous chapters at the beginning of this lecture, these are one of those that you would want to flag as sounding very similar and being spelled very similar. We have 3 Medrols there, but they are all different types. So we'll leave that for just one more second so you guys can take note of that. Medrol, Depomedrol, Solumedrol, Kenalog, and Decadron. Okay. So moving on, we'll talk a little bit about the pancreas. The pancreas sits posterior to the stomach. It functions as both an exocrine gland for digestion and an endocrine gland for the release of hormones. Okay, so it is dual functioning, exocrine and endocrine. The exocrine pancreas, it's the main source for digestive enzymes, amylase, lipase, and proteinase. And the pancreatic duct is what's going to transport those enzymes to the duodenum. The endocrine portion is closely associated with the blood vessels in our body. Pancreatic hormones are produced in the islets of Langerhans. Okay, the pancreatic alpha cells are going to secrete glucagon, and the pancreatic beta cells are going to secrete insulin. These are both proteins. So both regulate the metabolism of glucose in our body. Glucagon stimulates the liver to break down glycogen into glucose, which increases our blood glucose levels. And insulin stimulates the liver to form glycogen from glucose, which lowers our blood glucose levels. So those two are working hand in hand to keep our glucose levels. When that doesn't happen, diabetes mellitus is the result, which is the inability for our body to regulate the glucose levels. And there are two types. Type 1 is an autoimmune disorder. This is where the body is attacking its own pancreatic beta cells, causing a failure to produce insulin. That's when an outside source needs to be provided. These are people that are on insulin pumps or have to take insulin injections. Okay, then we have type 2. This is where the body's tissues fail to respond to the action of insulin on its target cells. This is usually managed medically with diet, exercise, or some medications. Okay, moving on to the ovaries. These are paired glands that produce estrogen and progesterone. Both are critical to the development and maintenance of the female sex characteristics. So there we're talking about menses, pregnancy, and lactation. They're available in tablets, capsules, and oil, which can be used for an IM injection. Estrogen and progesterone derivatives are used as oral contraceptives, and they can also be used for hormone replacement therapy post-menopause or post-oophorectomy. And an oophorectomy is where we've gone in, we've left the perhaps we've left the uterus behind and we're only taking the ovaries, or perhaps the patient has had a hysterectomy previously, but we do need to go in and take the ovaries as well. Either way, an oophorectomy is removal of the ovaries. It can be used to treat endometriosis in patients, female patients, and fibrocystic breasts as well. Common estrogens that are available that are synthetic are Premarin, Senestin, and Estrace. Of those, we use this Premarin quite often in surgery to assist with vaginal packing. So that is a synthetic that we will use, Premarin. All right, and finally we are going to talk about the testes just shortly. So these are paired glands located in the scrotum. Endocrine glands are situated throughout the testes, and they secrete the male sex hormones. These are called androgens. The primary androgen is testosterone. It is critical for the development of male sex organs and the maintenance of secondary sex characteristics in males. Okay, these hormones are used in the medical setting. They're usually not used in the surgical setting, and therefore they're not going to be administered from the sterile table. Okay, but it is a good idea to know that the testes are excreting testosterone. That is the main hormone from the testes. Okay, and with that, we are at the end of Chapter 8. It is a relatively short chapter, but there's quite a bit of info there. If you guys have any questions, leave them here, and very shortly here we will move on with Chapter 9 as well. All right, we'll see you soon.